In Michelle's uncertainty and nursing theory, there are major concepts and definitions of the theory that are reflected. The ones that I've chosen to highlight that are reflected of nursing is the nurse as a structure provider, the nurse as the credible authority, and understanding cognitive capacities of the patient. Now, for an uncertainty as an opportunity or danger, for nursing as a structure provider, the idea of the nurse being the structure provider is that they assist the patient in interpreting the stimuli frame, which is considered to be the symptoms that the patient is experiencing. So what the goal of the nurse is, and that in utilizing Michelle's theory, is that they need to help the patient understand symptoms and become familiar with them, because when patients are diagnosed with a new illness, their fears and uncertainty can come from not knowing what to expect. So if the nurse provides them with the accurate information that they need to understand the symptom trajectory, they'll know what to look for. So when they're having questions, they won't be scared, because there's been a lot of situations where patients will say, they'll ask you about a certain type of symptom that they're feeling, and they'll ask you if that's normal. And if you can teach them what symptoms are normal to look for versus what symptoms would be something where it's actually an emergent situation where they need to get immediate medical care, then it'll decrease their uncertainty. And then now, with regards to credible authority, it would seem that the credible authority and the structure provider are the same, but actually it's not. With the nurse as a structure provider, they're assisting in the patient interpreting their symptoms and getting familiar with everything. But with the credible authority, that's actually the most important part of it, because even if you provide structure for the patient, if you can't provide information that they deem as credible, then they're not going to have faith in you. The idea of the credible authority is that the patient needs to feel that they can have trust in the nurse who's caring for them, and the uncertainty is more heightened if they feel like they're not getting accurate information. So the idea with the credible authority, according to Michelle, is that the patient should be given simple information, but not to the point where it's so simple that it's generalizable to another person. You need to provide information that's succinct, accurate, and also it's customized to that particular patient's situation, because there's a lot of patients that have said that the reason why they feel uncertain in their illness is because they're just given a lot of generalized information, but nothing that is particular to their situation. Don't give them a one size fit all answer. Give them something that applies to their current situation, not something that applied to a patient that you saw a week ago. And then also, it's important to understand the cognitive capacity of the patient, because like I said, when you're providing the credible authority for the patient, your goal is to make sure that they can understand what you're teaching them. Because even if the information is accurate, if the patient doesn't understand what you're saying, they're not going to be able to process it, because they're going to be uncertain, because the terms you provide for them are things they don't understand. So when you speak to the patient, you need to use layman's terms. Like, instead of saying, to the patient, how is your blood glucose, you could just say, like, how have your blood sugars been. Some patients might not understand what you're asking them when you say something that might be simple to you. So you have to figure out ways to tailor it to that patient's educational level, which is why when we do our assessments on admissions, it's important for us to find out what the educational level of the patient is. And then also, it's important to be aware that uncertainty is an opportunity or a danger, because there's patients that can see uncertainty as something that is a negative problem, and they can respond to it in a way where what they do for themselves, like they don't do enough to take care of themselves, and then they end up being hospitalized because their uncertainty prevented them from being able to understand what you were teaching them, and they start to have a fatalistic view of what's going on with their health. Like, somebody who has diabetes could think that it's the end of the world. They could think they're never going to be healthy again because they have diabetes, versus somebody else who could think, oh, when they get a diagnosis of diabetes, they'll start using it as an opportunity to get healthy and exercise and lose weight. So you just have to be aware of what your patients are experiencing. As the nurse, it's your goal to guide them through it and help to allay their fears.